I mentioned a moment or two ago that the eMedia COVID-19 Relief Fund has raised almost R4.5 million. And some of that money will be going to the non-profit organisation Dlanathi. It helps children who have lost their parents to HIV and Aids by providing psychosocial support. It uses play to help them process their grief. For more on this, let's talk now to Rachel Rosenthal-Thresher from the charity itself. Rachel, good morning to you. Thanks so much for joining us. Before we talk about how you're going to use the money, tell me a little bit about the provenance, the origin of this particular organisation. My understanding, it's the convergence of three very powerful stories.
Yes, three very powerful stories. Good morning, Jeremy and everyone. We had a man dying of cancer who wanted to do something in his farming community, and he was observing the fact that he was processing dying, but he was watching his farm laborers dying and didn't know how to respond to supporting them and their children. And so he started to look for opportunities to help children understand what was happening in terms of HIV and AIDS. And there weren't a lot of people speaking to children or making sense of the disease for children at the time. And then we had the death of a young man, a young child, in a children's home being cared for by a social worker. And these three people came together, a play therapist, a social worker studying play therapy, and a family with a dying father, and together gave what they could. So the father gave his art and his life, and the family gave their energy to raising funds, and the social worker gave her time to work out how to help children understand what was happening. It
is the most astonishing story, and these days the valuable work that you're doing is more and more important, given that people who have HIV right now are possibly at greater risk, the greatest risk compared to other people.
They are, and I think that that's one of the things that we were so afraid of, in a way. I think when the COVID-19 epidemic or virus was raised, all of us in the organization went back to the early years of the organization where there was just a lot of death and a lot of loss. And we felt quite traumatized by that and thought we can't go back to that place as a country. And so we're very supportive of the action that the Department of Health and the government have taken. And I think swift, responsive action is what is needed.
So the way in which the pandemic has now changed your lives and the way in which you operate, has it been very, very difficult?
Well, I think that it is challenging in the sense that a lot of our work is face-to-face, so it's providing psychosocial support. It's much more difficult to do that remotely. But I also think that the team is working from home. We've made sure that everyone has access to connect digitally. We are connecting with the people that we serve, either through WhatsApp, through any kind of social media that we can. For those people who don't have smartphones, we are looking at providing bulk messaging to them and making sure that there's SMS contact so that people are not feeling disconnected and that they have someone that they can contact as they need, because clearly there's concerns around illness. There is a lot of fear in the community. People in general are complying with the lockdown, but there are concerns. And so it's very important that people have accurate information and that they have someone they know and trust who they can test things with and ask for help.
There can be nothing worse at this time than the fear, as you say, of being alone. Just finally, you will be a beneficiary of the money that we are collecting. How are you going to use it?
Well, the most important thing and the biggest fear at the moment is around the need for food. Families, I can't imagine any more stress than not being able to feed your children. And so we will be using the money to provide food support to vulnerable families at this time. And we know that it will help them feel that they're no longer alone and that there is a community supporting them and provide relief that allows them to cope, to find creative solutions to challenges ahead, and to be able to feel like they have the capacity to care for their children and themselves.
Rachel, from all of us here at eMedia, we salute the valuable and astonishing work that you are doing. Thank you so much, not only for joining us, but in the work that you're doing in this fight against the pandemic. So eMedia is pleading with businesses and the public to help disadvantaged communities by donating to the eMedia COVID-19 Relief Fund. Monies collected, as we've just illustrated to you, will be used to help the most vulnerable during this national lockdown. My colleague Teko Moagi